Hello, my name is Lisa McCarthy. I'm a pharmacist at Trillium Health Partners, a clinician scientist with the Institute for Better Health, both in Mississauga, Ontario, Canada. And I'm one of the lead researchers of the Deprescribing in Ontario Long-Term Care Initiative. It can be hard to know how to have meaningful conversations with your healthcare providers about medications. Shared decision-making is a way for people to share their medication goals and experiences with healthcare providers, who in turn share their knowledge of medication effectiveness and side effects so that together you can determine the best approach for you. This video was created to help you have these conversations with your healthcare providers by showing you an example. So let's introduce you to who you'll see in this video. Grace Wilson is 93 years old and has been living in long-term care for the past 2 years. She lives with high blood pressure, a heart condition called atrial fibrillation, and type 2 diabetes. Over the past couple of months, Grace has been experiencing diarrhea, which is understandably bothersome to her. She's asked to speak with Dr. Casey to discuss this. Let's watch as Grace and Dr. Casey have a conversation.
Hello, Grace. Nice to see you. I understand from your nurse, Betty, that you want to discuss some concerns you are having about diarrhea.
Hi, Dr. Casey. Yes, I feel so ashamed to be complaining about this. I know that people get the runs occasionally, and I hate making a big deal of it. However, I was looking at the infographic that the home shared with me, and it says it's essential for me to be part of the discussion of problems with the doctor. So I thought I would raise my concerns in case something could be done.
Well, thanks for sharing that. And I'm glad that the infographic helped you decide to talk to me. I understand that it can be challenging to have these conversations sometimes, but voicing your concerns will help us come up with a solution together.
It's just that it's not going away. It started a couple of months ago, but it's been getting worse and worse in the last few weeks. It happened a couple of times, and it's so embarrassing.
That sounds very frustrating. We did several tests this week to rule out possible reasons for the diarrhea. Everything came back normal, so that is good.
Well, I guess I should probably just suck it up then, but I'm getting very tired of it. It's affecting all the little things I usually do. I miss being able to go to the dining room and play cards with my friends. I'm just too embarrassed to leave my room, and staying here gets very lonely. I'm just not enjoying my days anymore.
Well, what am I hearing is that this interferes with the things you enjoy doing. So let's look at your medication to see if any could be contributing.
Yes, I was talking with my son the other night, and he also wondered if the medications had been changed. The infographic mentions that sometimes a decision about medications may need to be made.
Well, nothing has changed in terms of your medications. Often we may see a side effect like diarrhea shortly after starting or changing the dose of a medication. However, sometimes it can present much later, even though there hasn't been a change in medication. And this happens because the body doesn't handle medication like it used to. So looking over your medication list, I see that you're taking metformin for your diabetes. Sometimes that can cause diarrhea.
But I've been on that forever. How can we know if that's causing it?
The only way to know would be to reduce or stop the dose and see if the diarrhea improves.
Well, my goal is at least for the diarrhea to stop. So I'm willing to try anything. But what about my diabetes? Would it be okay? Is there some risk involved?
Well, that's a great question. When medication for diabetes are started at a younger age, the goal is to keep blood sugar levels at a lower range to prevent problems in the future, like heart attacks or nerve damage. As we age, it is important to revisit what those blood sugar targets should be, as they might not need to be as controlled as before. This means that a lower medication dose, or sometimes stopping the medication altogether, can be reasonable.
I think my sugars have been okay so far.
Yes, your blood sugar levels have been very well controlled. Most of your blood sugar readings are between 6 and 9. And your last A1C, which give us an idea of your 3-month average blood sugar control, was under 7%. As long as your blood sugars were to stay mostly under 10 up to 12, I wouldn't have any concerns trying a lower dose. And I would not be worried if your A1C was a little higher. The Canadian Diabetes Association actually considers that up to 8.5% has to be okay for older people. So how do you feel about that?
I see. Can you tell me what my options are and the risks and benefits of each?
Well, we could lower the metformin dose to see if that helps. If it is causing the diarrhea, it may be that you can still tolerate the medication, just a lower dose. With this option, you would still get some of the benefits of taking metformin, but it may be that you still have diarrhea. I would say the second option would be to stop the metformin altogether. In that case, we may notice more of a change in your blood sugar levels, but it would let us know for sure, either way, whether the metformin is causing the diarrhea. And the third option would be to stop metformin and switch to another medication for diabetes to help control blood sugar. It would be more than likely keep your sugars well under control, but given how well controlled they are already, it may be that you wouldn't need this extra medication in the first place. We would regularly monitor your blood sugars over the next several weeks with all 3 options. With the first 2 options, either lowering the dose or stopping metformin, there is always the option to add another medication later if needed to help with your blood sugars. And one last option would be to leave the metformin and add a medication like loperamide to manage the diarrhea. While this option might control the diarrhea, it doesn't help deal with what is causing the diarrhea and adds actually another medication to your list. I know I've given you a lot of options here. Well, do you understand each of them, or is there anything you would like me to review again?
I think I understand each option.
Okay, great. Do you have any idea then of which option you would prefer?
Well, I don't want my sugars to get too high, but most important to me is to get rid of the diarrhea. And if it could be the metformin causing it, I think I would prefer to stop it and see. I want to see my friends and play cards again. I do like the idea of keeping an eye on my sugars, though. And if they get too high, then we can talk about what to do next.
Absolutely. I think that it is very reasonable and seems to be in line with what matters most to you. So I will write an order to stop metformin. I will also update your care plan with blood sugar targets aiming for less than 12 and an A1C target of around 8.5%. And I leave instructions on monitoring your blood sugars over the next 2 weeks while we make this change.
That sounds good. I'll let my son know what we are doing to stop the diarrhea. He was very worried about me.
Definitely. So do you have any questions about anything?
Is there anything I should be doing while I'm off the medication?
That's a great question. Well, you can monitor your signs of high blood sugar, like fatigue, feeling extra thirsty, or needing to urinate more often. I'll add a note to the care plan so that the staff can also help monitoring this.
Okay, I can do that.
Okay, then, so I will check back with you in a few weeks to see how things are going. Does that sound okay?
Okay, thank you very much, Dr. Casey.
Of course. Nice to see you again, Grace. Have a great day.
This conversation between Grace and Dr. Casey was an example of a shared decision-making conversation involving a sensitive issue. With the help of a shared decision-making infographic, Grace shared her concerns with Dr. Casey, considered that a decision about her medication needed to be made, asked about the different options, and listened as Dr. Casey explained reasonable expectations. Once Grace felt informed about each option, she considered her own goals and preferences with Dr. Casey, and together they decided on the medication they both agreed with. While this video used metformin as an example, this type of conversation could happen with any medication. For more information and resources about shared decision-making and medication management in long-term care, please visit our website at www.deprescribing.org or contact us at deprescribing@bruyère.org. Our website also links our anti-hyperglycemic deprescribing guideline, algorithm, and patient pamphlet. We encourage people who live with type 2 diabetes to talk to their providers about blood sugar and A1C targets that are right for them.